Good day, everyone, and welcome back to our course in Critical Analysis and Nursing Scholarship. And today we're going to start our discussion in quantitative research. In particular, we're going to discuss two major types of quantitative research. First, the true experimental research design, and the second one is the quasi-experimental research design. Let us start our discussion by presenting a real-world example that highlights why research design matters so much. And this is the case of hormone replacement therapy, or HRT, back in the 1990s. At that time, observational studies suggested that HRT significantly reduced the risk of cardiovascular disease in postmenopausal women. These studies compared women who chose to use HRT to those who did not, and found that the HRT group had lower rates of heart disease. Initially, these findings were widely accepted, but later on, researchers and clinicians realized that these conclusions were actually misleading. The question is, why was it condemned? Now I would like you to pay attention on the slides in front of you, and you will see exactly what was the research design employed in such research. Now, the key problem of that study was that it was purely observational, meaning women self-selected whether to use HRT or not. In other words, there was no random assignment. Now, this is critical because women who chose to take HRT were generally healthier and more health conscious. They often exercise more, ate better diets, and avoid smoking. And this created something called selection bias. The groups weren't comparable at baseline. So the apparent protective effect of HRT was really due to the fact that healthier women were more likely to use it, not the therapy itself. Now, because there was no randomization, the studies couldn't adequately control for confounding variables. Now, what are these confounding variables? As previously mentioned, confounding variables are other factors influencing the study. And in this specific study, the confounding variables are factors influencing heart disease risk. For example, healthier lifestyle habits like diet, exercise, and smoking status were more common among HRT users. Without controlling for this, the studies couldn't isolate whether HRT alone was responsible for the lower heart disease rates. Now, why does this matter? Now, this research is an example that shows the danger of relying in a wrong research design. Without randomization and control of confounding variables, causation cannot be established. Misleading research like this can lead to incorrect medical guidelines and could potentially harmful health decisions. In other words, it might contribute to financial loss and possibly loss of life. Now let's try to go back to the steps in the research process and see where preparation of research design comes in. In our previous discussion, we started with the selection and defining a problem. After we defined and selected the problem, we defined the research questions and formulated research purpose. After that, we formulated our hypothesis and conducted a review of the literature. After doing those four initial steps, the next step in the process is preparing for research design. For today's session, these are our learning objectives. After completing this session, students will be able to first gain an overview of quantitative research methodologies in nursing. The second is distinguish between true experimental and quasi-experimental research design and identify their core characteristics. Number 3, evaluate the sustainability of each design for different research questions and scenarios, considering factors like control and randomization. Number 4, differentiate between non-experimental research designs in nursing, focusing on their unique features. And number 5, critically assess pros and cons of non-experimental research designs in nursing studies considering feasibility and ethical implications. Now, what is research design and why it is important in nursing research? Now, the study design is the structure that you build your research around. Think of research design as your study's blueprint or roadmap. It guides everything: how you collect your data, how you analyze your data, and how you answer a research question or test for your hypothesis. The research design is basically determined by the research question that you are asking and the resources you must work with. Also, research design is very important because it determines the quality of your research. Now, the type of research design you chose really depends on your research question. Now, I want you to look at your slides right now, where you can see two types of research question. For example, if you want to test an intervention, like whether a new wound care methods works better than the old one, most probably you will be using experimental design. But if you want to gather data at a single point in time, for example, you wanted to do a survey about nurses' job satisfaction today, you might probably choose cross-sectional design. In our next few slides, we're going to discuss the different types of research designs. Now, before you decide on a research design, there are some important things to consider to make sure your study will be solid and meaningful. And what are the considerations when selecting a research design? First, objectivity in research questions and design. Letter B, accuracy. And the third one is control and intervention fidelity. We're going to discuss each of these considerations in the next few slides. First is objectivity in research question and design. Now, research question and design must reflect that a review of literature was conducted. Now, what does that mean? Well, before you even pick a design, you need to do a thorough review of the literature. This is very important because it will help you understand what's already known about your topic, the depth and the breadth of existing knowledge about the topic that you wanted to research. So this is also very important because the review of your literature will guide you as a researcher in choosing the right design, because it will show you exactly where the gaps are or what questions still needs answer. Now, the next consideration is accuracy. All aspects of a study systematically and logically flow from the research question or hypothesis. Your research design has to fit your research question or hypothesis perfectly. For example, if you want to find out if an intervention causes a change, you need a design that can actually test cause and effect, like for example, experimental design. Now, using a design that doesn't match your question risks producing unclear or valid results. In other words, the choice of your research design significantly influence the entirety of your research process. The third one is control and intervention fidelity. When we talk about control, it refers to the implementation of measures or strategies to minimize the influence of extraneous variables and ensure that the study's results are valid and reliable. On one hand, fidelity refers to the degree of accuracy, consistency, and faithfulness with which an intervention or treatment is implemented in the study. This third criteria is very important. In quantitative research, controlling extraneous variables, and we all know what extraneous or confounding variables are. These are variables that might influence your outcomes but aren't your focus. As a researcher, you want to minimize their impact as much as possible. That's why experimental studies must be very carefully planned. Also, the intervention that you're going to deliver should be in a very standardized way. That means Every participant gets the treatment the same way under the same condition. And this consistency helps you be confident that any changes you see or observe are due to the intervention itself and not other factors. Now, talking about extraneous variables or confounding variables, there are several ways in how we can control these variables. Now, these are the suggested strategies on how we can better control these variables. First is randomization, which is considered the best way. When we talk about randomization, this means each participant in our research has an equal chance of being assigned to the experimental or control group. Now, random assignment helps balance out those unknown factors that could skew your result. In research, there are several ways in how you can randomize your participants. You can either use simple and basic Lathering method, or you could also use a more advanced method like the use of computer to generate the participants and to allocate them randomly into several groups. When randomization isn't possible, we use homogeneous sampling. What do we mean by this? So basically choosing participants who are similar in important ways, almost similar characteristics. For example, like age or gender. And by doing homogeneous sampling, we are actually reducing variability. Then we keep constancy in data collection. That means, as a researcher, we make sure that the environment, the timing of data collection, the tools that we use in our research, as well as the procedures that we follow to conduct the research are the same for everyone. And of course, we also have training and supervision of data collectors, which is very, very important, especially if we are doing a large research and we have a lot of research assistants or researchers involved. And of course, manipulating the independent variable. That means we apply the intervention to your experimental group and not the control group. And we're going to discuss manipulation of independent variable in the next few slides. Now let's talk about quantitative research design. The literature has broadly categorized them into three: non-experimental, experimental, and quasi-experimental. In the next few slides, we're going to discuss the different types of quantitative research design. Now, if you try to look back at the hierarchy of evidence that we have presented during our first session, you would notice that non-experimental studies and quasi-experimental studies, as well as the randomized control trials or true experimental research, fall under level 2 to level 4 in the level of evidence hierarchy. In nursing, we often use experimental and quasi-experimental designs all the time because many of our treatments, interventions, and programs need to be tested for effectiveness. And as nurses, it is very important for us to understand these designs so we can contribute meaningfully to research and improve our patient care. Now let's focus our attention to experimental research design, which you might know as clinical trials in the healthcare setting. Now, experimental research design is considered the gold standard for determining the cause and effect relationship. Now, what is experimental research design? Experimental research design is used when we want to understand cause and effect relationship. In other words, we want to know if changing one factors or variables causes a change in another variables. Now, the key feature that sets experimental designs apart is the manipulation of variables. I want you to look at the PowerPoint slides in front of you. Now, when we talk about manipulation of variables as a key feature of experimental research design, this means that the researcher actively changes or controls or manipulates the independent variable. For example, if you wanted to introduce a training program and observe its effect on the dependent variable, which is skills, here we can use experimental research design. In here, the researcher manipulate the independent variable by introducing a training. Okay, now let's try to look at these three research questions in experimental research. And I want you to read the three research questions and identify which variables are manipulated. First is, what is the effect of regular physical activity intervention on the blood pressure levels of elderly patients in long-term care facilities? In here, the variables that the researcher wanted to manipulate is physical activity, and that is the independent variable. The second research question is, how does the use of mindfulness-based stress reduction techniques impact the anxiety levels of patients undergoing chemotherapy? Very good. In here, the researcher intend to manipulate the independent variable by introducing mindfulness-based stress reduction technique. How about number 3? How does the provision of music therapy influence the sleep quality and duration of patients in a medical surgical unit? In here, the independent variable is music therapy. The researcher intend to introduce music therapy and see whether it has an effect on sleep quality and duration. Now, there are three important characteristics of true experimental research design that sets them apart from other research designs. First, randomization. The second one, control. And letter C is manipulation. And we're going to discuss each of these characteristics in the next few slides. First is randomization. A true experimental research design involves randomization. Randomization means assigning participants to different groups, like the experimental group or control group, purely by chance. Now, this process helps ensure that the groups are similar in all respects at the start of the study, including factors we may not even know or measure. Now, why randomization is very important? Now, randomization is important because if the groups are similar, any difference we observe after the intervention is more likely due to the treatment itself, not because one group was healthier or younger or motivated from the beginning. When we talk about randomization, there are two layers of randomization that we can do. First is random selection from the participants. And the second one, once we have already selected our participants, we can assign them randomly either in control group and treatment group. For example, imagine you're testing a new pain relief medication. In here, you randomly assign patients to the medication group or the placebo group. You reduce the chance that the medication group has, say, less severe pain at the start by accident. And this method could strengthen your confidence that any difference in pain after treatment is due to the medication. The second element of a true experimental research design is control. Now, the control feature means including a group that does not receive the experimental treatment or receive an alternative standard treatment. Now, this group serves as a baseline to compare against the experimental group. On the slides right now, you will see two groups, the control group and the treatment group. So basically, the treatment group receives the intervention and the control group receives either of the following. It could be no intervention at all, or it could be the usual or standard care, or it could be an alternative treatment, or it could be a placebo. It could also be a lower dose or intensity of treatment, or possibly it could be a delayed treatment. Now, why control is very important in experimental research? Without a control group, you can tell if changes in your experimental group are due to the intervention or other factors like time, natural healing, or placebo effect. For example, continuing with the pain medication study that we have just mentioned, your control group might receive a sugar pill or placebo or the current standard pain medication. And comparing results between the groups lets you isolate the effect of a new medication. Now, the third element of a true experimental research design is manipulation. Manipulation means the researcher actively delivers the intervention or treatment to the experimental group, while the control group does not receive it or receives something else. This is what creates the cause and effect ratio. Now, why manipulation is very important? Now, manipulation is important because you need to actively apply the treatment to see if it actually causes a change. Now, without manipulation, you're just observing, not testing the effect. For example, in the pain study that we have just mentioned, manipulation occurs when you give the new drug to one group, but not the other, then measure pain outcomes afterward. You control exactly what treatment is given and how, ensuring consistency. When we talk about true experimental research design, there are three common types of true experimental research design. First, the classic randomized control trial or RCT. The second one is Solomon 4-group design. And the third one is after-only design. In the next few slides, I'm going to present how these types of experimental research design is implemented, and I'm going to give you a specific and actual example of a research utilizing these designs. Now let us start with the classic randomized control trial or RCT. Now, in a randomized control trial, participants are recruited and baseline data are collected. Then, they are randomly assigned to either experimental group or a control group. The experimental group receives intervention, while the control group receives no intervention or an alternative one. Post-intervention measurements are taken to evaluate the effect. On the slides, you will see an actual example of research utilizing randomized control trial. And I want you to identify whether the three elements of a true experimental research design are present. And I'm going to read it. Yüksel et al. 2017 tested the effects of breathing exercises on labor pain and duration among women during the second stage of labor. 250 pregnant women who are randomly divided into two groups, 125 in intervention group and 125 in control group. Intervention group received one session breathing exercise training and performed breathing exercises during the second stage of labor versus the control group that did not receive anything or any breathing exercise training. In here, the three elements of true experimental research designs are present. First, there was a randomization because we can see that the pregnant women were randomly divided into two groups. The second one, the control is also available because in here, aside from the experimental group, there was also a control group. How about manipulation? In here, there was a manipulation because the experimental group receives the intervention, which is the breathing exercise training and breathing exercises. This is an example of a randomized control trial. The second type of true experimental research design is called Solomon 4-group design. Now, if you can see in the PowerPoint slides right now, this design includes 4 groups, 2 similar to the randomized control trial groups with pre-test and post-test, and you will see that there are an additional groups that only receive a post-test. In here, subjects are randomized into these 4 groups before any data collection. And these process is very important because it helps identify if the pretest influences the results. Now, for an example, in 2019, Deghan et al. Tested the effect of virtual reality technology in preoperative anxiety in children. A total of 40 patients undergoing abdominal surgery were randomly divided into 2 interventional groups and 2 control groups randomly. Now let us try to analyze if the 3 criteria of true experimental research designs are present. First, the presence of randomization. And here, we can see that the 40 patients undergoing abdominal surgery were randomly divided into 4 groups. How about control and manipulation? Definitely, there are 4 groups in this research, and there are 2 control groups. How about manipulation? The introduction of virtual reality technology to children in the interventional group suggests that there was a manipulation. Hence, Solomon 4-group design is an example of a true experimental research design. The last type of true experimental research design is called after-only design. In here, participants or subjects are randomized into intervention or control group. But notice that there's no pretest or baseline data collection. Only post-intervention data is gathered to assess differences. Now, on the slides right now is an actual example of research conducted with after-only design. Ordo and Kaliskan 2023 tested the effect of virtual game simulation on nursing students' perception of nursing diagnosis and clinical practice. 92 second-year nursing students were randomly assigned to the control and experimental groups. Both groups completed the data collection after. Now let's try to analyze if the 3 elements of true experimental research design is present. First is randomization. Is there a randomization in this research? The answer is yes. Notice that the 92 second-year nursing students were randomly assigned either to control or experimental group. How about control? Definitely in this research, there was a control group. How about manipulation? In here, there was a manipulation because the virtual game simulation was introduced as an independent variable. This is an example of after-only design, or in some other literature, they call it as post-test only control group design. Now let's talk about what are the advantages and disadvantages of experimental design. First, RCTs are considered the gold standard and the most powerful designs. In fact, in many clinical trials, in the hospitals in the clinical area, many of the research designs used are RCTs. The second one, it offers greater evidence than other design. However, there are also disadvantages of using experimental design. First, it is a complicated study to design because it has control group, it has experimental group, it has pre-testing, it has post-testing. And the second one is costly to implement. And the third one is it is difficult or somewhat impractical to implement. Now, using the hierarchy of evidence, you might notice that randomized control trials or experimental research designs are actually located at level 2 of the level of the hierarchy, which means that evidence generated by this research are often considered as best evidence. At this point, we are going to discuss the second type of quantitative research design called quasi-experimental research design. Why it is called quasi and how it is different from true experimental research design. Now let's talk about quasi-experimental design and how it is different from true experimental research design. Quasi-experimental designs are sometimes called trials without randomization. Like true experimental designs, quasi-experiments also involved an intervention, meaning the researcher can still apply treatment, program, or intervention, and etc. And just like true experimental design, quasi-experimental design also aim to test cause and effect relationship. The following research on the slides can also be conducted utilizing quasi-experimental research design. And in our next slides, we're going to discuss how exactly quasi-experiments are done. Now, so what's the difference between true experimental design and quasi-experimental design? As previously mentioned, a true experimental design has all the three elements: randomization, control, and manipulation. The key difference between quasi-experiments and true experimental design is that there is no random assignment of participants to group. Instead of randomly assigning people to the intervention and control group, the groups are formed in some other way. For example, based on what unit they work in, what hospital they belong to, or what program they're enrolled in. Some quasi-experimental design may or may not have control group as well. However, quasi, just like true experiment, also involve manipulation. Because there's no randomization, quasi-experiments are more vulnerable to bias. The groups might differ in important ways before the study even starts, and those differences could actually influence the result. Now let's talk about the types of quasi-experimental design. But before that, most probably many of you are asking, why do we use quasi-experimental design in the first place? Well, the answer is, sometimes randomization just isn't practical or ethical. Maybe we can randomly assign patients to different wards. Sometimes it's impossible. Sometimes it's not practical, and sometimes it's unethical. Or maybe the intervention has to happen at the organizational level. Quasi-designs let us study real-world intervention in this situation. Now, there are four types of quasi-experimental design. We have the non-equivalent control group design. After only non-equivalent control group design, one group or pre-test and post-test design, and we also have time series design. In the next few slides, we're going to discuss how each of these designs is different from one another, and also we're going to give a specific example of a research conducted utilizing such designs. The first type of quasi-experimental design is called non-equivalent control group design. I want you to pay attention in the slides right now, in the lower part. Subjects in these research designs are assigned to intervention or control groups without randomization. The outcomes of the two groups are compared. In this research design, you would notice that the experimental group has been given an intervention while the other one was none. However, obviously in this type of research design, the selection of participants or the assignment of participants in either experimental and control group did not involve randomization. Now let's try to take an example. Kwan et al. In 2013 tested the effect of group music therapy on brainwaves, behavior, and cognitive function among patients with chronic schizophrenia. Participants were assigned either to experimental group or to the control group. The experimental group participated in the group music therapy for 13 sessions, while control group only received a standard treatment provided in the hospital. Now let's try to examine whether or not the three elements of true experimental research designs are present. First is randomization. As previously mentioned, in quasi-experiments, there is no randomization. In our given example, no randomization has been conducted because the patients were assigned according to their wards. However, if you would notice, there is a certain type of control in here because there was a control group and at the same time experimental. How about manipulation? Manipulation is also involved in this research because music therapy was introduced in the experiment. And this is an example of quasi-experimental research design. Now, what are the pros and the cons? Now, non-equivalent control group design is more feasible when randomization is not possible. And this type of research design also allows comparison between groups. However, some of the cons of this research is that there might be a selection bias, mainly because there was no randomization that occurred. And because of that, groups may differ in important ways, and these differences could potentially affect the result. The second type of quasi-experimental design is called after-only non-equivalent control group design. In here, subjects are assigned to groups without randomization, and no pretest data are collected. Only post-intervention outcomes are measured. I want you to look at the diagram on the slides right now. Obviously, there was no randomization that was conducted to assign the subjects either to experimental and control group. Notice that there was a control group and at the same time experimental group. In here, there was a manipulation because an intervention is also applied in experimental group and the post-intervention data are collected. However, it is very obvious that in this type of research design, there was no data collection that occurred in the baseline or before the intervention was implemented. Now, I want you to look at the real study conducted using after-only non-equivalent control group design. Taha et al. 2021 tested the effect of adding structured simulation to a traditional classroom room lecture format on students' knowledge acquisition and their evaluation of faculty teaching effectiveness compared to traditional classroom lectures alone. The students at one campus, designated as the control, received 4 hours of traditional lecture-only instructions. The group at the second campus, the intervention group, received the same lectures with added simulation. Now let's try to examine the 3 elements of true experimental design. First, randomization. In this example, there was no randomization. The second one is control. Obviously, the research of Taha involved both control and experimental. How about manipulation? There was also manipulation of the independent variable by adding structured simulation to a traditional classroom. Now, what are the pros and the cons of this research design? First, it is very simple to implement. And this type of research design is very useful when baseline data is not available. However, there are also cons to this research. First, there is a high level of selection bias. Of course, there's no randomization. And because there's no pretest that has been collected or baseline data collected, you cannot measure changes over time. And it's very difficult to infer causality. The third type of quasi-experimental design is one group or pre-test and post-test design. One group receives an intervention and measurements are taken before and after the intervention. However, I want you to look at the slides right now on the lower part of the PowerPoint and notice that there was no control group and there was no randomization. Now, I want you to look at the actual example of a research conducted using this design. Ferro et al. In 2023 tested the effect of live music therapy interventions on vital signs and levels of discomfort and pain for pediatric patients in the PICU. 259 patients were included. Vital signs of the patients in the pain scale were measured before and after music therapy intervention. Now let's go back to the 3 elements of true experimental design. Let's talk about randomization. Obviously, in this research, there was no random assignment. The second one, presence of control. In this research, there was no control group, only the experimental group. And the third is manipulation. In this research, there was a manipulation because a live music therapy was introduced. Now, what are the pros and what are the cons of this type of design? First, it is simple and very inexpensive, and it can provide preliminary evidence of effect. However, this type of research design has various cons. First, because there are no control groups to compare to, it is very difficult whether or not the intervention is effective. And of course, you cannot rule out other alternative explanation for the outcomes. The fourth type of quasi-experimental design is called time series design. In here, data are collected repeatedly over multiple time points before and after the intervention in a single group to observe trends and rule out external influences. I want you to look at the PowerPoint slides right now, and you will see that there's only one group, the experimental group. There was no control group in time series design. Also notice that baseline data and post-intervention data are collected over multiple time points. Notice that there is a manipulation also because an intervention is applied. Now, I want you to look at the actual research conducted by Muklish et al. In 2020, in which they tested the effect of cupping on reducing patients' blood pressure. 20 hypertensive patients participated in the study. Blood pressure of the patients were checked 3 times a few weeks prior to the therapy. Participants underwent cupping therapy every 2 days for 3 weeks. Data was collected after the intervention. Now, let's try to go back to the 3 elements of true experimental research design and let us see whether or not they are present in here. First is randomization. Obviously, in the research of Muklish et al. 2020, there was no random assignment. The second one is control. Obviously, the research of Muklish et al. 2020 doesn't involve control group, only experimental group. However, there was a manipulation of variable. Why? Because the introduction of cupping on reducing blood pressure of the patient is the manipulation conducted by introducing the intervention. Now, what are the pros and what are the cons of time series design? Because data were collected over multiple time points, in here you can detect trends and rule out confounding events. And this type of research design is stronger than the previous quasi-experimental research designs that we have used. However, there are also cons and disadvantages of this research design. First, because there was no control group, causality or the cause and effect relationship might be a little bit challenging. And since it involves data collection over multiple times, it requires frequent data collection, of course. And finally, external events coinciding with intervention may still bias result because you don't have control group in here. Now, what are the advantages and disadvantages of quasi-experiment? First, this type of research design is practical, less expensive, and sometimes only feasible alternative. And it can also provide a replication of the study to strengthen the evidence. However, there are few disadvantages of using this research design. First, because of lack of randomization, the researchers might not be able to demonstrate clearly the cause and effect relationship. And of course, obviously, this is less powerful than true experimental design. And in some cases, it is difficult or impractical to implement. Now, if you try to look at the hierarchy of evidence or level of evidence, quasi-experimental studies lies on level 3, just beneath the level 2. And that ends our session on experimental and quasi-experimental research design.